Hi, my name is Dr. Leo Polosajian. I'm a cardiac electrophysiologist and peripheral vascular disease specialist. And there was a question regarding exercise and the effects of exercise to the heart. I had a 42-year-old patient who had a sudden cardiac death while cycling. Now, a lot of people may ask, exercise is good for you. You should continue exercising. Yes, it is. However, there's extremes of exercise, obviously. So the patient who had a sudden cardiac death and was revived, luckily, by two nurses, this is a true story, and lived, and then received an ICD implant and continued to live, was an extreme cyclist. He used to wear the monitoring system on his chest in order to find out how high his heart was increasing, etc. He was an avid cyclist to a point where his heart was overacting. As a result, he ended up with an arrhythmia, and it caused sudden death. When people ask me what is a good length of time to exercise and a safe, it would be approximately 30 to 40 minutes of walking daily, or 3.5 to 4.5 miles of jogging daily, instead of increasing your heart rate really high and then dropping it down, such as mountain bike riders. Mountain bike riders get their heart rate up really high as they're going up the mountain, as an example, and then they're slowing down because the bike is going down by itself with gravity. That is not good for your heart. So increasing the heart really high and then dropping it down is not good, because that's what we do actually in the electrophysiology laboratory to induce an arrhythmia. Technically, if someone is doing this daily, they're actually trying to induce an arrhythmia per se. However, if you increase your heart rate slowly and keep it up that level and then drop it down slowly, you'll find.
The question that ties into this, like people like myself, I take pre-workout and go to the gym. Have you had any cases with that?
The intensity is important, and the length of intensity is also important. So when we bring patients into the hospital in order to induce an arrhythmia, especially let's say atrial tachycardia or atrial fibrillation, we pace the atrium as fast as 300, 400 beats a minute in order to basically induce them into an arrhythmia. We pace, stop, and then the heart would come back either to normal rhythm or induced into an arrhythmia. So when someone is cycling really hard, they're really getting their heart rate so high, and then because they get tired, they can't go anymore, and then they stop or slow down, the heart's still going, it can trigger an arrhythmia.